Hey there, it's Dr. Jim. Thanks for spending some time with me. I have an important topic, particularly if you are a formal caregiver or an informal caregiver. Maybe you're a nursing assistant, a nurse, someone who works in senior care or healthcare, or maybe you're taking care of a loved one at home and you're a caregiver. I was a caregiver for about 16 years, and it was a blessing. And it was an honor to be a caregiver for my mother. But I know that it can be very, very challenging. So, my topic today is caring for older adults with memory loss. And that's going to be a lot of people now and in the future. So, one of the greatest fears among older adults, and maybe you and I right now, is memory loss and all of the problems that are associated with it because there are plenty. And while slight changes naturally take place as we age, as a gerontologist, I know that. We're going to have little incremental changes in our memory, not like that. There are a number of physical, mental, and neurological conditions that do lead to forgetfulness and deterioration in memory. And these conditions actually do frighten us. Caring for someone with memory loss can be both rewarding and challenging. Thankfully, there are many things that can be done to help maintain or actually improve their memory. So, what is memory loss? Let me address that very quickly. Generally speaking, memory loss means the inability to remember names, places, events, or situations over a period of time. Everyday memory loss can be caused by stress, by being overwhelmed, a lack of sleep, and just the normal aging process. More significant memory loss, though, can be associated with a physical illness, a psychological disorder, a neurodegenerative condition, or certain substances like drugs or alcohol. Now, there are lots of types of memory disorders, and I always go back to the old DSM-5. It's not actually that old, but to me, it's like the old DSM-5 because I'm always digging through it. Most memory disorders develop when parts of the brain become compromised and the ability to store, retain, or remember information becomes a problem. Unfortunately, memory disorders affect almost every aspect of our lives, including our cognitive abilities, language, problem solving, social behaviors, and even the ability to perform everyday, normal, simple tasks. Memory disorders also range from mild to moderate, severe, and sometimes extreme. Some may be immediate, while others are progressive. Now, some types of memory disorders include the following: Alzheimer's, frontotemporal dementia, vascular dementia, dementia with Lewy bodies, which we're really learning more and more about these days, mild cognitive impairment, progressive supranuclear palsy, Parkinson's disease, and Huntington's disease. Now, some forms of memory loss are reversible or temporary, and which mean they're very short-lived. They're diagnosed, they're treated. Some conditions causing reversible memory loss include the following: depression. Yes, depression can really hinder your memory. Drug use, alcohol use, normal pressure hydrocephalus, hypothyroidism, infections, and something very important that we need every single day, vitamin B12, because a deficiency in vitamin B12 can cause memory problems. Medications, minor head trauma, injury, certain brain diseases, they can all cause reversible, treatable memory loss. So that's good news, right? Here's some symptoms to watch for if you are a caregiver. Depending upon the type of memory disorder and the unique individual, symptoms of memory loss are going to vary. They're going to be different from person to person. For instance, those with Alzheimer's will experience a long, slow loss of memory over the course of years and sometimes decades. It's a long, long, gradual goodbye. Signs of gradual memory loss appear in stages of the disease, with memory becoming progressively worse over time. In frontotemporal dementia, though, it's quite different. It's difficult to detect any signs of memory loss early in the disease process. Symptoms of memory loss can include the following: confusion, an inability to learn new or novel information, repeating questions or statements often, language difficulties, an inability to communicate, wandering or getting lost, paranoia, problems with managing money, and trouble with reasoning. Now, let's talk about diagnosing memory loss. If you're caring for someone with memory loss and they exhibit a lot of those symptoms that I just talked about, it might be time to seek professional help, go to a specialist, start with your family practitioner. You could schedule an appointment to see your general practitioner first, and then he or she might refer you to a neurologist, psychologist, psychiatrist, gerontologist. But it's best to be prepared to answer some questions during the examination about that individual's lifestyle, his or her work habits, personality, their medical and family history, and their overall health, because that person who's having memory problems may not be able to fill in the gaps and answer all those questions accurately. Or if you're working in a nursing home and the doctor's visiting you're a nurse, a nursing assistant, and you're with that individual all the time because you work with them, you might actually be able to help with this process. Now, diagnostic tests might include the following: neurological tests, a physical, a neurological exam, laboratory tests, specialized brain imaging studies if they're called for, and neuropsychological testing. Okay, but that's getting pretty deep. Now, here are some treatments to think about. Once a diagnosis is provided, a treatment plan should be developed and several interventions should be considered to help that person better handle their memory problems. Any treatment should aim to prevent symptoms from worsening, to improve overall functioning, and to maintain a good quality of life. Today, there's a better understanding of memory loss due to a number of conditions. We come a long way. There are newer pharmaceuticals that might be prescribed, as well as a number of non-pharmacological interventions. There are various treatments to look at, including the following: medications, cognitive rehab, nutritional supplements, which I'm a big fan of, physical activity and exercise, social interaction, staying engaged and involved socially, and a safe and comfortable environment to live in. The individual with memory loss or significant memory disorder can be cared for a team of professionals, including the following: neurologists, neuropsychologists, neurosurgeons, psychologists and psychiatrists, occupational, physical, speech therapists, nurses, social workers, case managers, nursing assistants. Big interdisciplinary team effort. Common sense ways. This is a good part or a good way to end our episode here, because these are everyday things that you can do to help that person's memory on a daily basis. Diet and nutrition, really important. Monitoring the person's diet is a great place to start, because excess sugars are associated with cognitive decline and memory. Less alcohol is encouraged because it can produce memory problems all by itself. And what is really preferred is a high antioxidant, anti-inflammatory diet, because that can really help with memory. And reduced or eliminating refined carbohydrates, which are known to damage memory, anything with white flour. Number 2, adding fish oil or other supplements to that person's daily diet is a good thing to do. Curcumin, cocoa, fish oils, rich in omega-3 fatty acids, other supplements like a little bit of caffeine and ginkgo biloba might be a good thing to do. Maintaining a healthy weight. Obesity can actually impair memory. Exercising, having some type of ongoing physical activity is extremely important. Getting enough sleep. Engaging in mental and social stimulation. All important things to do. Here are some of my final thoughts. As we age, our memory may not seem as sharp as it once was. And while some decline is normal, memory loss that impairs daily living may be caused by underlying conditions that need professional attention. Caring for someone with either memory loss or a diagnosed disorder does require special attention to the signs and the symptoms, receiving medical care, and engaging in everyday activities that might slow the decline and improve overall function, and something we're all aiming to do: enhance or maintain quality of life. Thanks for spending time with me. I'm Dr. Jim. I hope you keep coming back for more information. Thank you so much for taking some time to watch the video. I appreciate it. And if you're a licensed healthcare professional who's looking for some great continuing education, we've got it. And we are always working on brand new, fresh content for you. So you can find the link to the website in the description, and keep coming back for more information. I hope to see you soon.